Hi everyone, Gareth Presch, founder of the World Health Innovation Summit. Delighted to be joining you from Helsinki here, Radical Health Festival, joined by two good colleagues, Roxanne and
Hello.
Hannah.
Hello.
We're just going to do a short live session here. We want to talk about the Radical Health Festival. Firstly, Hannah, why are you here and what do you make of the Radical Health Festival?
Oh, it's such a pleasure to be here and connect with new people as well. We're here proudly representing our partnership with the World Health Innovation Summit and to also represent RED as well and the role of RED as a public health initiative that's empowering people to move for their mental health. But for us, really, we're here to listen, learn, share insights, meet with incredible people in this space that are doing wonderful work to really understand the needs of communities and how people can be most supported around those needs as well. So we're so proud to be a part of this and to really be kind of a thought leader in this space and to come together as a community and to understand what change you can make together on the ground. So it's just been, it's such an honor just to listen to incredible individuals in the space, including Roxanne as well.
Thank you, Hannah. Hi, everyone. So I'm here because I'm here as a patient voice. I have a long and diverse medical experience as a patient. And so I wanted to make that voice heard, mostly that I say I'm a patient voice because I'm not a patient. I'm a lot more, and I'm a person like we all are. And we're all patient at some point in our lives. And I think that's a very good reason to also pay attention of that side of the equation and understand how we can tap into those resources as well to work better together and achieve better health outcomes that work not only for the patients but also for the persons behind the patients, because those are the only ones who really live and exist in the world.
So it's been really exciting to be here. What I've noticed, the team here is really about this shift, this paradigm shift, this radical health vision at the finish have kind of sort of like, shall I say, started the ball rolling. From your perspective, because you spoke last night, you spoke today, do you feel that we're making progress? Because keep in mind, it's a hard job to shift the health system from sick care to healthcare.
That's a good question. That'd be a politically correct answer. I think we're still very good at naming all of the hurdles on the way and forgetting that literally every little helps. If we all are part of the system, we all have some power and influence to change it. And that's really what I'd like people to live with, that there's no right framework to start than just do it.
Yeah.
Isn't that sort of like what we've done here? We've kind of been impromptu. We've kind of said, like, let's just do a live. But that, I think that's kind of where Hannah comes in, because like Hannah started RED, okay, as this massive movement on mental health and well-being across the UK. And what I've noticed over the last couple of years is, I mean, you must probably have touched 1 million lives, I would say, like by people getting involved in physical activity. So do you feel like we can learn from RED? So health system could learn how do you make that transformation, not just from small little drops that we see at the moment, but to a seismic shift towards prevention?
Massively, because the essence of RED is it's a movement. It's powered by people. We wouldn't be here as RED without empowering individuals and communities to go out there and spread the message in a way that works for them as well. And it's been very much led by the individual. We very often, after RED January, go out there into communities and shape the initiative with people. We want to listen and learn. We're never, I know you said this so beautifully as well, we don't have all the answers. And actually, we want to come together with the community to shape that. So, that's very much kind of at the heart of what we do.
So we have this shift, people coming together, communities. You spoke yesterday, but the policy. Now, we had 3 ministers speak yesterday. I was very excited by the fact that they were actually, making that, sort of public statement that they want to shift healthcare system from the current model, which is failing, unfortunately, to this preventative model. And they were really articulating that does that give you hope for the future? I mean, do you think we'll actually see the budget move? Because you need the money to flow
absolutely.
into prevention.
It does give me hope, one, that we have diagnosed the health system as outdated and we're putting the work into change that. It does give me hope that we've understood that health needs are shifting from curating disease to more chronic health problems that needs just a different model of care, and where the best difference is the attack with prevention. So that I find really reassuring. I think as well it was very interesting to hear different states and ministers collaborate, and I think that for me was very encouraging.
Okay, so we have to make this brief because we're actually on the stage here, just so that if you're viewing, and there's another session about to start. But just finally, Hannah, how can people get in touch with you? And Roxanne, how do people get in touch with you?
Yes, so LinkedIn, Hannah Beecham, please connect. Would love to understand how together we can help reach and support more people to move for their mental health.
Same thing, Roxanne Levy on LinkedIn. You can also find me at Cassandra with a Q.life.
Okay, thanks. We got to get off the stage because they're about to start another session here. Thanks for joining us, and any questions you can always connect with us on LinkedIn. And remember, our aim: empower people, give people the tools to manage their own health and well-being, and find out more at WIS.world. Thanks, everyone.
Thank you, Gareth.
Bye bye.
Thank you, Hannah.
Thank you.